Mental disorder is the leading cause of poor health, disability, or even death in Singapore among youngsters aged between 10 and 14. Numbers suggest over 1 in 4 is affected. Overall, the impact of mental distress on the population is the highest in the region. And this is according to a new, first-of-its-kind medical study done by National University of Singapore and the University of Washington. Researchers had assessed public health in the region from 1990 to 2021. Regionally, mental health cases have soared by about 70%, growing notably during the COVID-19 pandemic. In 2021 alone, 80.4 million people were affected, commonly by anxiety, depressive disorders. The study is calling for a collective regional response to strengthen mental health research capacity. Now, mental health is among the top 5 disease burdens in Singapore. Over 650,000 cases were diagnosed with such disorders in 2021, affecting close to 13% of males and just below 12% of females. But it's not just the youths that are suffering. Cases also increased threefold among seniors. Injuries through self-harm and falls make up 8% of disease burden here. Despite Singapore having the lowest deaths from injuries among its neighbours, self-harm makes up almost half the injuries. It's commonly seen in young adults aged 20 to 24. Over 1 in 5 deaths was also caused by falls, which could worsen as the population ages. Resulting disabilities could add more stress on the public health system. Now, Singaporeans had done well to prevent and manage cardiovascular diseases, with the lowest numbers in the region and below the global average. Researchers say that's because of decades of investment in prevention, early diagnosis, and high-quality cardiac care. But cases are up by nearly 200% in the last 30 years. The trend is driven by an aging population and lifestyle shifts. It's also the second leading cause of deaths here. Smoking rates and related deaths have also dropped in Singapore. It's the lowest regionally. In 2021, just over 1 in 5 males here aged 15 and above was a smoker, significantly lower than close to 1 in 2 in Southeast Asia. But for females, even though much lower, numbers were higher than the regional average. Researchers say continued vigilance is needed to stem the growing use of e-cigarettes and vapes.
There is a huge gap in health providers in other parts of the world in terms of lack of specialists. And so Singapore can lead the way as serving as a training hub in the ASEAN region. I think second is knowledge exchange. Singapore has lots of success in public health policy, including road injuries prevention, smoking control, tobacco control. So it would be great for Singapore to share the best practice and continue to expand this knowledge exchange platform.
Well, for a closer look at this, we have lead author, Associate Professor Marie Ng from the NUS Yong Lin School of Medicine. She's also Associate Professor at the Institute of Health Metrics and Evaluation. And also on Zoom to our right there is a family counsellor and psychologist, Adrian Lim Peng Ann. Welcome to you both. Thank you for joining us on this very, very important topic. Prof. Ng, if I could ask you first. Mental health disorder numbers for 10 to 14-year-olds, they're not looking pretty, are they?
They are not, and this is definitely a concern. I think one thing that I should emphasize is that the pattern in Singapore actually mimic the high-income countries, and then there are various reasons that's driving the trend.
Why are they so worrying for you, Prof. Ng?
Because the onset of mental disorder in early age tend to linger to adulthood. So you have different ramifications in terms of continuing experience of mental disorder, can also affect physical health as well.
Right. You heard Prof. Ng there, Adrian, saying that this starts young and tends to carry through. As a mum of someone in that age group, I find that quite worrying, especially in this digital age.
Oh, certainly. Yeah. And it's very much the transition point for most of the primary school students going into secondary school, which also coincide with the puberty, the menarche for the young ladies and the young gentlemen growing up. Those are the developmental biochemical changes in your body, the testosterone, progesterone, and all that is actually activating. And that may lead, if it's not properly supported at home especially, and at school, is going to go haywire, plus the digital interference, I call it, the use of devices, media, that actually alters the cortical neurological processes in the brain, because it is at the transition process, not only physiologically, but neurologically also.
Right. So you're building these pathways in the brain. It's sort of like a perfect storm, isn't it? And what are some of the mental health problems that can arise from that, Adrian?
They are also, because they are also going through an identity search that, if not well undertaken, they are not affirmed, validated, supported, encouraged by especially their parents, father and mother. And in this stage, for the boys, and it's the father, right, who confirms a boy to be a man.
Yeah.
Right. And for the daughters, it is the father who confirms them to be a woman. While the mother plays a very important supportive role, it is critical that both father and mother play a synergistic role in complementing, supporting, encouraging, affirming their future. Right. And this is where it's so important that the marital relationship is fully intact and thriving.
Oh, Adrian, we're going into a whole different topic right there. But, thank you for that. If I could bring the conversation back to you, Prof. Ng, because we've got one end, the young ones. Then we've got the older ones at the other end, the seniors. They're also suffering from mental wellness issues. Can you talk to us about those figures?
Right. So what we are observing is that because of the increase in the aging population, the sheer number of people experiencing mental disorder is increasing. If we are just looking at incidence rate, it actually has been fairly stable over the last 30 years. But the increase in the sheer number of cases imply there's a higher demand for healthcare services.
It does. I want to, Adrian, this is a group, these older ones, especially the 60 to 74, that are the least likely to come forward for help, the most likely to fall through the cracks. So I'm wondering, how do we ensure they're not left behind, and how do we ensure that Singapore is able to cope with this as an aging society?
I have not looked at the data, but I would guess the more challenging one are the male retirees, where again there is a transition point for them. Women generally cope better because they are more communicative. They have support circles among women, right? Not so for the men. And I have worked with many men, all the way from the youngest 6-year-old boy up to the 79-year-old man, right? In my psychological work and training, this is a challenge. So, if you're going into retirement within 10 years, you need to be prepared for a life after work. All your titles will cease, your income will cease. You don't feel good about yourself because you're not gathering income, no more titles to go to, no more office of my own. So all those things also push them to have a crisis for some.
Understand. And Prof. Ng, you heard there, the preparation for that time in your life is essential. But also the fact that it's going to impact Singapore's aging population. It's a flag, isn't it, of sorts to the government?
Correct. So we are currently still understaffed, I think, in terms of the mental health professionals. So if we look at figures such as like the psychiatrists to population ratio, Singapore is substantially lower than the high-income countries.
Okay, just the last question for the both of you. Prof. Ng, start with you. If we were to repeat this survey, let's say midterm, 5 years, what do you think the trajectory would be when it comes to maybe the young and the old? Better?
Currently, I'm still a little conservative. primarily part of it is driven by what Adrian mentioned, the social media influence, because social media triggers anxiety disorder, conduct disorder. So unless there is a robust strategy to help teenage or even general population cope with like the temptation of social media, I think we might be seeing like continuous growth in mental disorders.
Right. And Adrian, just very quickly, what would you like to see done differently so that we can reverse this trend very quickly?
Developmentally, parents need to be much more equipped. And I have always been proposing that parenting life skills future for parents, and you don't move. You need to move forward and support your child, because ACEs, advanced childhood experiences, neglect is one of those key issues. And children going into infant care, especially in childcare too early, right, is deprived of maternal and paternal relationship, and attachment theory shows very clearly. And many of my clients who I've worked with, one of the questions I ask is basically, how was your relationship with your parents when you were young? And ask the parents the same thing. And many of them are in childcare, many of them are in infant care. This is only my case load for the last 32 years.
Thank you so much for that reminder. And as I like to say, parent the child you have, not the one you want. So thank you both, Associate Professor Marie Ng and NUS Medicine and psychologist Adrian Lim. Thank you.